Welcome to our comprehensive exploration of the Canadian healthcare system. An emblem of national pride, the system now wrestles with numerous challenges that have tested its mettle, transforming it into a complex labyrinth of issues. Overcrowded hospitals, understaffed emergency rooms, and protracted waiting periods have become characteristic of this system. Amidst this maze of issues, emerges the crucial role of the family doctor, the primary care provider, serving as the cornerstone of the healthcare experience. However, reality is that not everyone is fortunate enough to have a family doctor. Those without one are left with the only alternative: a quick fast food style service, a walk-in clinic where exhaustive diagnosis often takes a back seat. Doctors in these clinics place emphasis on addressing one symptom at a time for speedy consultations, aiming to invoice the system and make hassle-free, quick money. This creates a healthcare environment where the focus is on quantity over quality, a clear departure from the fundamental principle of comprehensive healthcare. But you may wonder, why is a family doctor so important? Family doctors keep track of their patients' symptoms and health developments, which can help them anticipate potential issues. Moreover, family doctors generally try to provide a diagnosis and will refer your case to a specialist less reluctantly than a walk-in clinic doctor should you require specialized medical attention. Walk-in clinic doctors are not only more reluctant to refer cases to specialists, but they also avoid providing a diagnosis and focus instead on treating individual symptoms to make you feel comfortable, thus masquerading serious potential underlying conditions with a false sense of well-being. The situation is further complicated by the rising number of immigrants arriving in Canada, exerting additional pressure on an already overburdened system. The ballooning immigrant population, while theoretically enriching the nation's cultural mosaic, inadvertently exacerbates the burden on the healthcare system, financed by the citizens' substantial annual taxes. The strain on the system has resulted in a growing waiting list for family doctors, with stories of patients succumbing while waiting for medical attention becoming alarmingly commonplace. That's right. Some patients die while waiting for the medical attention they need. Things like cancer, chronic conditions, or even organ transplants can go unattended for a very long time, hence resulting in many deaths. A study conducted in 2020, for example, showed that 8,400 Canadians died while waiting for healthcare. Further, the ever-increasing number of patients has caused a shift in the approach to healthcare, and instead of preemptively addressing preventable medical conditions, the healthcare system has pivoted to a reactive approach, dealing with symptoms as they appear. The high immigration rates are causing the healthcare system to buckle under its own weight. The system, though accessible, struggles to deliver timely and efficient care, teetering on the brink of a crisis. Behind this free universal healthcare lies a system strained to its limits, where the price of inadequacy is ultimately paid by the patients. Often hailed as free, the true cost of healthcare in Canada bears more than meets the eye. This reality doesn't simply knock gently on the door, it breaks it down for Canadians who contribute an astounding percentage of their income in taxes to sustain this system. The cost of this system isn't just deducted from their paycheck but also extracted from their quality of life. Yet, this massive contribution doesn't guarantee superior healthcare. In a cruel twist of fate, Canadians are paying steep taxes for a system that may not provide timely and efficient healthcare when they need it the most. But just how steep are the taxes paid into this system? In 2021, the per capita expense by the government on the healthcare system was close to $6,000. This means that every taxpayer in Canada would have contributed roughly $6,000 in 1 year to the healthcare system, which equates roughly to $500 a month poured into a system that is not only inefficient but seldom used by most of its contributors. The system is not just under stress, it's lying on a bed in the emergency room, wrestling with an escalating number of patients, and a rapidly declining number of doctors. The consequences are grave, severe, and life-threatening. A chilling scenario is often played out where individuals risk their lives waiting for medical aid that might come too late. They are paying upfront for a service that often keeps them on hold, or worse, loses their lives while waiting. It's a bitter pill akin to investing in an insurance policy that fails to deliver when you need it most. As the wait time for a family doctor continues to rise, Canadians find themselves in a state of disillusionment, left questioning the value of their investment. Not just about discomfort anymore, the conversation has shifted to fairness and receiving what they are entitled to. They are asking, demanding proof that their investment in healthcare is not in vain. This brings us to a critical juncture, a point of introspection and evaluation. The question isn't just about the cost, it's about the value, the return on the investment. Despite shelling out a steep price, are Canadians receiving a healthcare system that meets their needs? Or is free healthcare failing to deliver its promise? Canada greets thousands of immigrant doctors and nurses each year. Despite this, a crisis haunts this so-called universal healthcare. Even with these new arrivals, gaps persist. Immigrant doctors face hurdles to practice in Canada, including recertification and unrecognized qualifications, restricting their ability to help. This leads to wasted potential and resources. Despite federal and provincial governments' awareness of the matter, only minimal efforts to expedite the certification of healthcare professionals have been undertaken. A series of tests developed by local boards, medical professionals, and other specialists could ease the pressure on Canada's struggling healthcare system while providing immigrant doctors with a way to prove themselves as qualified professionals to work in Canada. More doctors result in improved patient care, reduced wait times, and robust emergency responses. Strategies to promptly verify qualifications are needed and yet unavailable. An efficient evaluation process could unlock a potential pool of medical professionals. The issue is not capacity, but willingness to change for the better. The potential is clear, the need urgent, yet the system resists. To wrap up, ambitious immigration targets and a declining number of healthcare professionals are resulting in inadequate service and sometimes death for many patients using the Canadian healthcare system, which is funded by the taxes of these very patients. Follow us for more content. We will continue to release videos with some of the negative aspects of immigrating to Canada for you to have information beyond the positives that are often available online to help you make an informed decision.